And even at the beginning of the phone call saying, do you have 5 minutes to accept a referral? Because actually, ultimately, if they are that surgical reg in resus, they might say, actually, no, if it's not urgent, can you call me back in 10? And then it might be a much more reasonable conversation.
Hello, welcome to the Coffee on Call Medicine podcast, a podcast series to help ease your transition from medical school to foundation. So sit back, put away the textbooks, and grab a coffee. Enjoy.
Hello and welcome to the Coffee on Call Foundation Medicine podcast. My name's Rachel and I am joined by Kitty.
Hi.
And by Richard.
Hey, morning.
Good morning. So today we are going to be talking about requesting and receiving referrals. So I know this is something that people can be really anxious about before starting work. And I think that's, it's justified that people feel anxious. What are your guys' experience in terms of feelings about that?
I think whenever you have to make a phone call and ask for advice, you can kind of feel somewhat vulnerable that you might either get told off or even maybe shouted out or have like a real negative experience from it. So I think it is something that people feel quite scared of doing when they start work. That's on the one hand where you're kind of like phoning out for help. But equally, if you're in a position where you're going to have to receive phone calls, which is not typical for an F1 to be fair, but if you're getting phoned and expected to make decisions or give people advice, then that you can feel out of your depth quite easily, and it's about how to manage those sort of expectations, I suppose. So I think, yeah, definitely, I would agree it's something that promotes a bit of anxiety in new doctors, definitely.
I would agree. I would also argue that almost as an F1, I think you do sort of receive referrals because you often get bleeps from nursing staff and other staff on the ward with, questions. So yeah, I think there is an element of getting used to answering bleeps as well as making those referrals as an F1.
Yeah. And I think we wanted to focus on talking about how we can make that less scary. So is there anything that you do beforehand to prepare for making a referral?
So I think it's important to know, like, why am I actually, what the question that I'm asking, why am I in this position? Why am I making this referral? So get that clear in my head. So read back through the notes. Even if the patient's really, really unwell, there's always time to read the notes to check why you're phoning the radiology. Like the 2 minutes it takes you to read is definitely going to save you time. So it's worth investing the time in finding out what's going on, what's the plan, what's the background, why are they here. Is the scan to determine whether they're going to go to surgery? Is the scan to determine whether they've got spread of some tumour? Like, what is the actual point of doing the scan? Because that gives you some idea of what you're selling to the radiologist so that they can understand what you want. So get all those information sort of organised. I would go through the notes and like scribble them down quickly. So just make sure I know. So there's nothing worse than being asked how old someone is and looking at a date of birth at 3 a.m. and desperate to try and calculate their age. So like write down, this is an 86-year-old female, that kind of thing. And then when you ask those questions, you've got them to hand. And then I guess it comes with a bit of practice. There are certain questions you can start to predict that you'll get asked. So things like if it's an MRI scan, like, have they had an MRI scan before? Have they got any implanted metalwork? Have you got a pacemaker? All these things. And you can, if you get in your head, if you put yourself in the radiologist's shoes and you need to work out what they need to know, then it makes your preparation a lot easier. So you know that they don't want to microwave someone's pacemaker. So if you put that in your mind, then you can check whether they've got a pacemaker before you phone them, that sort of thing. You know that they're going to ask you about kidney function due to concerns about contrast and things like that. So you can look up the U&Es before you phone them and get them all written down. And that way your phone call can just be a little bit more slick because you kind of anticipate what they want, give it to them on a plate. That kind of takes a lot of the stress out of it, I would say.
Yeah, Richard, you kind of alluded to there, having a bit of a structure, knowing what you want to say, maybe writing down the key points. Mm-hmm. And I know I like to have multiple tabs open, which has all that different information there. I know that in a different podcast, we'll be talking about S-bars and what that means and that using that as a structure for making referrals. Kitty, do you have a structure that you use?
Yeah, so before I talk about structure, the other thing I would add to what Richard said is you talked about preparation and just get, clarity in the communication in what you want and why, but also be willing to have an open discussion with the radiology reg when you're asking for a scan. It may be that you've asked for a CT scan, but actually that's not the most appropriate scan and an ultrasound is better, but actually be open to that and don't worry if that's the case. You don't want to be exposing a patient to unnecessary radiation. And the other thing I would say you know, when you're making any referral, including radiology and referring to other specialities, is be honest, because actually, you know, the person you're on the phone to hasn't seen the patient. You're the one that's seen the patient. They're relying on your information. You know, does this patient need contrast or not for a CT? Does this patient need to be seen by this speciality, or is verbal advice the most appropriate thing? But they can't give accurate advice unless you give accurate information over the phone. So just take your time to prep, take your time to get to know the patient before you make the referral. But yeah, for sure, for referrals, so I'm often on the receiving end of a referral, and I find those referrals much easier if there's a structure used. We've talked a little bit about SBAR, but in addition to that, what I tend to tell my juniors to do is prep. Recognise your agenda, so agenda recognition when you're on the phone. Say why you're calling. Is it because you want me to take over the patient's care? Is it because you want verbal advice? Is it because you want me to come and see the patient? And they're all very different things. But be clear with that at the beginning of the phone call. Equally, is it because your consultants asked you to speak to me? Which is fine, but I would much prefer to know why you're calling at the very beginning of the conversation. Then present the patient, SBAR, and then again, clarity and communication, just reiterate why you're calling and what you want, and be willing to have that open discussion.
Yeah, so you know, you're referring to having a headline, an opening statement at the start, you're selling what you want, and then you're kind of closing it with that same statement at the end type of thing. Yeah. So we've talked a lot about structure, about preparing for it. Have you had a situation where you've had a referral gone badly, and how did you deal with that?
Well, it depends what you mean by gone badly. I think it's quite easy for a referral to go quite south quite quickly if you haven't done the prep and you haven't done the sort of you haven't done your due diligence in terms of like finding out the information. But sometimes you can have done as best as you could possibly have done and tried your hardest, and it still doesn't go that well. And I think it's important at that point to just remember that everyone in the hospital is probably quite busy, and actually the fact that someone has maybe been a bit short with you or snapped at you, whilst that's not okay, it kind of probably reflects that they're having probably an even worse day than you are at that moment. So just take a second to, rather than taking it really personally, that the person who has snapped at you is probably not having the best day either, and just think like, oh, you know, it's I would personally view it as being quite embarrassing to start snapping down the phone at a junior doctor who phones you. So almost pity the person who, as Mr. T would say, like pity the fool who would kind of like start chewing you out on the phone, because it probably means they've had a shocker. So just take a second to think like, that was a bit unexpected, and then actually reflect why did you, is there something you could have done differently? So did they ask you a question that you hadn't prepared for, that in hindsight you've kind of like messed up there? Or have you done your best and they've been a little bit unreasonable? Unfortunately, like the world being, it's a sort of it's a murky swamp of uncertainty, stress, like what's that word that you use? VUCA, volatile environments and all this. So like sometimes people are going to react unpredictably on the phone, and that's just parcel of work, but it's not okay to be made to feel rubbish. So I would say once you've kind of reflected on it, thought, could I have done that differently? You then still need to like prioritize the patient. So did this person really need a scanner now? Or, you know, did this person really need a cardiologist? Or did, you know, whatever needed to be happening as a result of your phone call probably still needs to happen, even though you got shouted at, right? So put the patient first. So think like, how am I going to get this sorted? The best advice is probably then to speak to your team. So speak to your registrar and say, well, you know that scan you wanted, or you know that cardiology opinion you wanted, or you know that surgical review. I rang them and like, this is what happened. And there's a few things that might happen there. They might give you advice about how to get what you want. So they might say, oh, well, what you need to say is this. Or they might say, actually, I'll phone them, which does frequently happen. So escalate, I would say. Put the patient first, and then it's always about like reflecting. So what did you do? Did you do what you could have done? And if you did do what you could have done and you still got chewed out, probably just feel sorry for the person at the other end who's having a shocker.
Yeah, I agree. And I think also reflect on why you think the referral went badly. Is it because you called for the other specialty to take over this patient's care and they didn't? And actually, is that the worst outcome, or actually, given the information that you now have, having spoken to that specialty, actually is that the most appropriate thing for the patient? And just because it's the thing that, you know, not in line with the thing that the consultant wanted you to call about, it doesn't mean that it's a bad outcome of a referral. It just means it's the best thing for the patient. So just reflect a little bit on why you think the referral went badly. And if it's because you didn't get what you want, it doesn't necessarily mean that referral went badly.
Yeah, and you can use it as a little bit of a learning experience.
Yeah.
Great. So I think we've covered quite a few tips there. If we were to kind of think about one takeaway tip for making a referral or dealing with a referral that's maybe not gone as well as you hoped, what would that tip be?
Oh, for me, it would be think about what's going on in the background behind the person that you phone. So if you phoned the general surgery reg, let's say, and they've been particularly short with you, is that because they're stood in the middle of resus with a patient actively bleeding and they're getting asked 200 questions at that end, and then you've asked them something without any of the information? Like, empathise with why that might not have gone well. And before you start your phone call, empathise. What do they need to hear from you to help? I think that's the biggest thing. Put yourself in their shoes, really.
Yeah, I like that. And even at the beginning of the phone call saying, do you have 5 minutes to accept a referral? Because actually, ultimately, if they are that surgical reg in resus, they might say, actually, no, if it's not urgent, can you call me back in 10? And then it might be a much more reasonable conversation. Yeah. But no, I would agree. Prepare, recognise your agenda at the beginning of the conversation, and just keep the patient and patient safety at the forefront of your mind. You're having this conversation with another specialty or the radiology registrar ultimately to keep your patient safe. So be honest, accept their advice, and have a conversation with them about what's best for the patient.
Yeah. And I think basically just reiterating what we've said already, but mine would just be prepare. And you will, like you said, Richard, get to grips with what is needed. So, if you're referring to cardiology, you're going to need to know what the ECG shows, for example. And, having those tabs open or the notes in front of you is going to really help with that. Great. So I think we'll bring the podcast to an end then. Thank you very much for listening to Coffee on Call.
Thank you.
Thank you.